Local 10 News, your problem solver station.
Medics can determine if a man will go bald, but they can also hold the key to successful hair loss treatment. Your details on the other side of this break.
An estimated 35 million men in the U.S. suffer from hair loss, 40% starting at the early age of 35. Well, now a South Florida transplant surgeon is turning to genetic testing to help his patients determine their risk for hair loss and even how well they'll respond to treatment. When Noah Davis hit 40, he was faced with a harsh reality. He was losing his hair.
Unfortunately, some of my image is caught up in my hair, and I feel it affects the way I look and how I feel about myself. In an effort to preserve the hair he has and possibly even restore some that's been lost, Noah turned to South Florida hair restoration specialist Dr. Alan Bauman. For patients under 40 who still have a full head of hair, Dr. Bauman is now using a genetic test that assesses the risk of hair loss by looking at the androgen receptor gene.
That comes back in A or G. A, you're going to be okay, 70% chance that you're not going to have severe hair loss over the course of your life. If you have a G response, then you're going to need treatment.
One of the key forms of treatment for male pattern baldness is a drug called Finasteride, but it is expensive, about $1,000 a year, and may also cause sexual side effects.
These are extremely rare, they're reversible, but men are fearful. And so they want to know, hey, is this medication really going to benefit me, doc?
Dr. Bauman can answer that question using another genetic test that determines the individual effectiveness of finasteride based on something called the CAG repeat score.
And we know through research, scientists have found a correlation between the CAG repeat score and the severity of hair loss, and the CAG repeat score and the response to medication. So you've got some miniaturization going on in these areas.
Noah's test showed he would only have a slight response to finasteride, but he may combine that medication with other therapies, hoping to boost the results.
If it increases my self-worth and makes me feel better about myself, then I think it's worth it.
And many hair loss specialists still recommend a multi-layered approach to hair loss, which might include a topical treatment like minoxidil, nutritional support, as well as cold light laser therapy. When all else fails, of course, transplant surgery could also be an option.